Today on the Daily Slant, we're going to talk a little bit about blood pressure and what those numbers mean. Typically, for an adult, a healthy blood pressure is below 120/80. Pre-hypertension is between 120 to 139/80 to 89, and high blood pressure can be 140/90 or higher. Now, don't just take one reading, let's get your average blood pressure reading. Typically, take your blood pressure at the same time every day over the period of 4 to 6 weeks to get an average of what your blood pressure is on a regular basis. Remember not to drink coffee, and if you have a full bladder, to use the restroom first. Sit down in a comfortable chair with your feet flat on the floor, and make sure your blood pressure cuff is on a bare arm on bare skin and not over clothing, as this can actually change your reading. A good time to take your blood pressure every day is when you first wake up in the morning, when your body is still resting, before you get in the shower or get dressed, or right before you go to bed at night, again, when your body is nice and relaxed. It is normal for your blood pressure to be raised when you're exercising, exerting yourself, or under a lot of stress, so those types of readings are not what we're looking for here. Your blood pressure is how hard the blood pushes against the walls of your blood vessels as it circulates through your body. When you have your blood pressure taken, or when you take it yourself, you get a reading in two numbers. 120/80, for example, like the normal healthy adult. The top number is systolic, and the bottom number is diastolic. Systolic is the heart pumping pressure, whereas diastolic is the pressure between heartbeats. Typically, this pressure is measured in millimeters of mercury, and it's written as 120/80 with mmHg next to it to stand for that. High blood pressure, hypertension, stage 1, stage 2, high blood pressure, all these things can lead to heart damage and other organs to be damaged. Now, you can lower your blood pressure by exercising, losing weight, eating a diet low in sodium and high in fruits, veggies, whole grains, sometimes low-fat dairy or no dairy at all, and limiting use of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen. That would be Advil or Aleve if you use brand names. If you don't see progress in 3 or 4 months after trying some of these things, your doctor may prescribe medication. Now, there's no set numbers for low blood pressure. If you're below 120/80 significantly and you faint a lot, you might want to see your doctor. There's not much you can do, but eating foods with more sodium might help for someone like you.